Her first seizure was at 6 months, and it came out of nowhere. We were very shocked. The fire department and the ambulance came. She seized for about 15 minutes, and the paramedics told us she had a fever, and it was very low, like 99.5. So not nothing that was out of the that's very low. And they wanted to take her to the hospital, and we were very much on board because we were very concerned. And got to the hospital. They ran all these tests. They told us it was febrile seizures, and it shouldn't happen again. And if it did, to come back. On the way home, she seized again in the car. So we turn around. We hadn't been gone from the hospital 10 minutes, and she seized again. They admitted us that night. They did an EEG. They couldn't find anything wrong. They told us, again, it's probably just febrile seizures. She'll grow out of it. It's kind of scary, but don't really worry about it. And then from that point forward for the next, so that was in December, January, February, March, April. So for the next 5 months, she had at least one seizure a month. And we were just told to treat with Tylenol, keep her fever down. We ended up going back to the hospital in March because she had a seizure that did not involve a fever and was foaming at the mouth. At that point, then it kind of like flagged the doctor's chart, and we were asked to come in for some genetic testing. And after Gracie did the initial genetic testing, which was just swabbing the mouth, they found out she did have Dravet Syndrome, which is her diagnosis. The neurologist said she thought maybe that's what was going on because of all of the things that had happened in that short time period with her seizures. And so she did test positive. She has Dravet syndrome, which is really, it's identified as the SCN1A is the mutation. And so at that point, we had the diagnosis in April. Yes. And then we started her on medication because she was only to 11 months old at that point. So it's a spectrum on severity. So every child with this condition has the SCN1A mutation. And then there's a spectrum of severity. So it can be mild, very, really seizures up until maybe 5. And then you don't necessarily grow out of it. It's not a thing that happens, but your seizures lessen. Then it can be kind of moderate fever, seizures, some developmental delays, which is where she is right now. She's kind of in the middle. And then the severe side is loss of function, severe, I can't think of the scientific word, severe, like immobility, brain, I'm sorry, like brain damage from the seizures. Some kids can be on a feeding tube. Some kids and these are really the older kids that have more of the severity because Dravet wasn't really researched except for the last maybe 5 years. So the older kids that have it have the more severe end because they didn't know about it. Science didn't put a lot of research into it because they didn't know. So Dravet is a medication-resistant epilepsy. So from what I've been told from the neurologist, a medication might work for a period of time, and then it stops and you have to try something else. And then it stops and you have to try something else. Her seizures from October to now have been really bad. She has a lot of atonic head drops, and she's like this all the time, just constantly. And she right now has a cut across the bridge of her nose and a black eye right here, because yesterday she had a head drop and fell on the edge of the table, and that caught her fall. She wears a helmet, but it doesn't have a face guard, and it's in the process of being ordered right now because she can't do much. This morning she was eating breakfast and she couldn't hold her spoon because she kept having these seizures, these atonic head seizures, and it causes her to jerk. And sometimes her food flies off her tray, or her spoon flies across the room, or she drops her cup or whatever. So all that to say, in January last month, when we went to see the neurologist for a routine appointment, Gracie had 2 black eyes, a cut on under one eye, bruised cheeks, a bump right here on her head. I mean, she looked like she had lost a wrestling match. She was so bruised and banged up. And I told the neurologist, this isn't working. She can't do this. This is not okay. She can't be a kid. She can't play. She can't walk across the room without hurting herself. And we have carpet in our living room, and that's where she spends the majority of her time. And sometimes she just falls face first into the carpet. And if you fall hard enough, nothing is going to be soft. Corpus callosotomy. So because of the type of seizures she's having, the neurologist who was observing her EEG recommended the corpus callosotomy. Talked to Gracie's neurologist. They worked together on the same team. She agreed. They presented it to the board. They all agreed. We met with the surgeon 2 days ago on Tuesday. And right now we're just waiting for them to call us to schedule the surgical appointment for her to have the corpus callosotomy. Recovery is about 1 to 6 weeks. Usually it's less for younger children because they're young and they seem to recover faster. Of course, there's initial, what do you call it? There's initial, I can't think of the word. There's initial things that you can run into, after the surgery, the child could have slow speech, slow muscle, regaining muscle movement and things like that. But I mean, it's a brain surgery. So that's kind of to be expected. They might be slow to eat. So Gracie could have a feeding tube for a little bit. Usually those aren't long-term. Usually those things go away. Again, the younger, they say the younger, the better, the quicker those things go away. Of course, she could have stroke, brain bleed, or they told us one other thing: stroke, brain bleed, or infection at the incision line. But that is very rare. They said it's 1 to 2% in all patients that's happened. And they have been older patients. And the surgeon that will be doing Gracie's procedure, that hasn't happened in the patients that he has performed the surgery on. So that makes us feel good. But he's specifically focused on young children with epilepsy at Cook Children's Hospital in Fort Worth, Texas. So that kind of narrows down the patient pool, I guess, for him. So we were told that her speech would probably be slow to come back. We might have to do some speech therapy, which she's already in speech therapy. She does not communicate well, and that could be due to the medication, or that could be due to the seizures, or it could be due to both. But she isn't speech therapy. She does have a physical therapist that she works with, and also it could be the fact that she has epilepsy, it could be the fact that she's on medication, or it could be both. So those things could be slow to come back, but the majority of patients regain those functions within 6 weeks. Of course, if she has a stroke or a bleed, that could be completely life-changing. So that's a little bit frightening. And my husband and I were talking, do the benefits outweigh the risk? And because it's 1 to 2% chance that it could happen is very unlikely. With the type of seizures that she's having, we want her to have a better quality of life. And this seems like the benefits would outweigh the risk.